Good afternoon, and welcome to our monthly Campus Health Committee Town Hall. My name is Lori Lozon-Clabo. I'm the Dean of the College of Nursing here at Wayne State and serve as the campus's Chief Health and Wellness Officer. Joining me today, two members of the Campus Health Committee who are, I'm sure, getting to be very familiar to folks who watch us on a regular basis. Joining us first is Dr. Tina Chopra. Dr. Chopra is a professor of medicine in the Division of Infectious Diseases here at Wayne State and the corporate medical director for hospital epidemiology, infection prevention, and antibiotic stewardship at the Detroit Medical Center. Dr. Chopra's research interests around epidemiology of healthcare-associated infections, infection prevention, antibiotic stewardship, and immunization. And Tina is a very valuable member of the Campus Health Committee. And next is Dr. Ramona Benkert. Ramona is the Associate Dean for Academic and Clinical Affairs in the College of Nursing. She is a leader in the administration and management of the Campus Health Center. Dr. Benkert has been an adult nurse practitioner for 30 years. Her research interests center around medical mistrust. And again, Dr. Benkert is an incredibly valuable member of the Campus Health Committee. And I'm grateful to both Tina and Ramona for being with us today. To get us started, obviously, lots changing in the city of Detroit since the last time we talked, and some changes on campus this week. So wanted to just give everyone a sort of heads up about where we are. We have said all along that the Campus Health Committee and the university leadership monitor a number of metrics in our local area as well as on campus on a weekly basis. And we have published a series of trigger metrics that, when reached, cause us to take a series of actions. And we report those trigger metrics, our testing rates and positivity rates, on the Campus Health Center COVID dashboard every Monday. Weekly data is published Monday by noon-ish. And this week, on Monday, the city of Detroit reached a positivity rate of 16.1% over the previous 7 days. And that caused us to do a deep dive, make a call to university leadership to talk about what the appropriate steps are. And while it was at the time the only trigger metric to be triggered, it does merit our attention. And so you saw on Tuesday a message from President Wilson to the campus community that is posted on the coronavirus website. And the link has just been provided at the bottom of the screen. Moving some non-essential campus functions to a more remote operation where it's prudent and possible. This is simply a step to try to reduce the volume of people on campus for a period of time until city rates stabilize. And as of today, the 10-day positivity rate in the city of Detroit has dropped considerably to 12.1%. We are still following cases on campus, which are higher than they've been in the past, and the positivity rate on campus, which is also higher than it's been in the past. Both things we anticipated as a result of Thanksgiving travel. You'll remember last time we were all together, we talked about the fact that we anticipated a spike at Thanksgiving, and we have seen that. But we're going to keep a very close eye on those data moving forward. Lots of questions about commencement. And I do want to just emphasize for students who are listening to us today that the on-site commencements planned for December, for mid-December, are likely to occur after this bump has subsided. We expect that the bump will subside long before then, and that we have taken a variety of measures to make sure those ceremonies are safe. They're going to be smaller, a little shorter than usual, and a variety of mitigation methods, including making sure that guests attending commencement are vaccinated. And we have every reason to believe that commencement is going to go ahead as planned. We're encouraged and optimistic that commencement happens as planned. So don't be worried about commencement. We know how important that event is in a student's career. So we are full of questions today, and a lot of them center around booster shots. So I'm going to start, Dr. Chopra, with you. And the first question that we've been asked is there any data on differences in side effects or negative reactions from the different boosters?
Thank you, Dean Clabo, for having me today. That's a great question. The side effects from boosters are going to be exactly very similar to what effects you had with your primary series, with the first or the second dose. So you are going to react very similarly to to how you did with the primary series, and they are very much limited to pain, fatigue, slight fevers, chills, which will last for a day or so, and then you will be back to normal. So they are very, very similar to the same reactions.
Thanks. I'm going to keep you here. Next one is related to that. Can I skip my booster, or should I wait until there's a new booster which is guaranteed to work against the emerging Omicron variant?
Another great question. So I would highly recommend, as an infectious disease physician, as an epidemiologist, that you get your booster shots, because there is evidence that there is waning immunity with the primary series of vaccines over time. And we've seen that from data from the US, from data from other countries, that there is waning immunity. And that's why we are seeing the Delta variant here in Detroit. And in this particular surge, even in vaccinated individuals who are more than 6 months out of their vaccination, fully vaccinated individuals. So I would highly recommend that you take your booster. Even if we are seeing the Omicron variant, I would still get the booster, even if we are not sure whether the booster is going to be effective against the variant. We know that these boosters and these vaccines are very effective against preventing severe disease and death and serious illness and hospitalization from COVID. And that's why I highly recommend the booster. I would not skip the booster.
So this next question, Tina asks you to get out your crystal ball and predict the future, which is not anyone's favorite activity. But do you think it's likely that we're going to need annual COVID-19 boosters?
I think the answer to that is yes, because the fact that globally there is such a high amount of vaccine inequity, and the virus is getting a lot of chances to adapt and to develop more variants. And the adaptation is happening because not all of us are vaccinated. The entire globe is not vaccinated, and since the virus is adapting, we also have to adapt, and our adaptation is getting the vaccination. So to answer your question, yes, we may require an annual COVID shot, which may be a newer shot that will be developed with other variants in it. That may happen. We are already hearing that from Moderna, and it may be required, or it may be present, and it may be because of the variants, and it may be very useful for us as a society to move on with life. Dean Clabo, you are on mute.
I'm sorry. It wouldn't be a meeting if somebody didn't do it. So today it's me. One of the questions is, what about teenagers who were vaccinated last spring? Any thoughts that they will need to get a booster soon?
That is another great question. I would wait for CDC recommendations and more data on that age group. As of now, according to CDC, adults more than 18 years of age, if they are more than 6 months out of their original vaccination, they recommend a booster in them, because there's emerging data on waning immunity in those age groups. As far as teenagers are concerned, as an epidemiologist, I can say yes, they may require it eventually, but we don't have that recommendation as yet from CDC, because we also need more data to back that recommendation.
And, when we talk about the duration of immunity and the time since initial vaccination, I think we often forget about the J&J. And CDC recommends now for adults 18 and older that they get a booster 2 months after the single dose of J&J. So 2 months after J&J, 6 months after one of the mRNA vaccines, right?
That is correct, and thank you for bringing that up, because some of us have had the J&J vaccine. So for us, the recommended duration is 2 months after, and those that have had the mRNA, it is 6 months after. So you are absolutely right.
Next question, I'm going to, I'll take this one. About the new Omicron variant. Is it Omicron or is it Delta that's causing this current bump we're seeing in the city of Detroit? And is this surge worse than others we've had so far? And what we know about what's happening on campus is we're seeing the circulating variant is almost 100% Delta variant. We have not detected the presence of Omicron on campus yet, but there's every reason to suspect that now that that this variant is in the United States, it will eventually make its way to Michigan and very likely make its way to our campus. But there's no indication at the moment that Omicron causes more serious disease. And in fact, some early data that suggests that symptoms are even less severe than those who have become sick as a result of the Delta variant. Anything I missed in that, Ramona, Tina?
I think the only thing to mention is that we do know that Omicron is highly contagious and transmits much easier as compared to Delta. And again, with this new variant, I would highly recommend that we get our boosters. Also, the patient that has been diagnosed with the Omicron in California had received the 2 shots of the vaccine, but not the booster. So it can escape immunity as well. So it's very important that we do get our booster.
Great. And a next question is, will the new variant show up on our PCR tests? And the answer to that is yes. We do variant analysis on a subsample of all of the PCR tests that we do on campus. And that would be the same in any other location where someone would have a PCR. Variant analysis is possible, and the variant analysis will detect the Omicron variant. Dr. Bankert, let's see. People are thinking about holidays and travel. How scared should we be this holiday season now that we appear to be in the middle of a 4th wave?
Well, I'm actually pleased that someone asked this question, because my guess is it's on the minds of many people who are in the audience right now. And I think also with this volatility and uncertainty, that creates fear and anxiety in everyone. But I think arming yourself with accurate information is really the first step to help reduce anxiety and fear, particularly surrounding the holidays and any plans you might have with friends or family. And as Dr. Chopra already mentioned, viruses mutate. That's sort of what they do. So I think knowing that and knowing that how this virus is acting is really no different than other viruses. And I think we can still continue to do, many of the things we did in prepping for the Thanksgiving holiday, wearing masks, keeping, getting the booster as we've said loud and clear already, and making sure that you are if you're ill, or even if you feel like you're coming down with a cold or think it's a cold, to really stay away from family gatherings until those symptoms abate. So I think if we take those smart measures, we can, safely proceed with holiday plans.
And obviously for us, a big difference from last holiday season was that we have vaccines available. Mm-hmm. And certainly here in the Wayne State campus, we have a largely vaccinated community. And that gives us one additional measure of confidence. I think we've all talked about the fact that we're all tired of wearing masks, and that we're starting to see signs of mask fatigue and people choosing not to wear masks in public settings. And that we often underestimate, even with all of our rapid scientific advancements, the importance of masking in reducing the transmission of respiratory-borne illnesses. I know, Dr. Chopra, you've been a big proponent of mask wearing for a long time as an adjuvant to vaccination.
That's correct, and I totally agree with Ramona on this point that despite the fact that we are vaccinated, masking should continue, and also testing. If we are sick, we should definitely go and get tested so we can protect others around us.
Mm-hmm.
And I will put in the plug for the Campus Health Center, reminding people that for members of the Wayne State community, there is no cost for testing at the Campus Health Center. The directions as to how to schedule an appointment for testing are available on the Campus Health Center website. And please, if you have, as Ramona said, if you think you have the sniffles or allergies, it's a good idea to get tested, schedule an appointment for a test. And also remember that we are testing for the presence of influenza as well at the same time when we do our PCR tests at the Campus Health Center. So important that we find out whether you have a cold, the flu, or COVID. Ramona, is at-home testing reliable enough to get together with unvaccinated family and friends?
Well, the rapid antigen testing, which does not amplify the virus, which is what we see with the PCR testing, is less sensitive. So if you're deciding to take one of those, one of the things you need to be aware of is that early in the phase of infection, so if it's, for example, the first day that you're feeling sniffles or runny nose, it may not be as effective as the PCR, and you can get a false negative. There is a difference between the type of testing. Some may be more accurate than others, but roughly they're about 85% sensitive as compared to the PCR, which is much higher. I would say if you're getting together with unvaccinated family and friends, I think it's important, particularly if you have symptoms or if the individuals are unvaccinated, that they get tested, and preferably, a day or so before, and preferably the PCR versus the rapid testing. So that would be my recommendation. We use the Binax now for our antigen testing at the Campus Health Center, and there's mixed sensitivity. So it is useful. It is available. It's easy to get over the counter. However, I think it's not as sensitive. So the PCR is your best gold standard.
Tina, anything to add?
I totally agree with Ramona. The at-home tests, some of them are better than others. Like the Abbott, for example, is better than others. But the time at which you test is extremely important. And also, if you don't have symptoms and you are testing just to make sure that you are okay, even that may not be very amplified, like Ramona mentioned.
Really, really good advice. Thank you both. Dr. Banker, will booster shots become part of Wayne's COVID-19 mandate?
Well, at this time, the Campus Health Committee and upper administration there have discussed it, and there's no plans at this point to mandate the booster. But as you know, just like what happened this week, we really watched the data very carefully, and should the data change, should CDC or the WHO or other scientific bodies recommend it, we may change that. But at this point, no, it's not on the mandate for the winter semester.
And I might just add a sort of logic question for those of us who have had our first series, is if a booster's available and we've seen the evidence of what a booster does in terms of immunity, why would I choose to skip it? Why wouldn't I take advantage of that opportunity if it's made available to me? So yes. I say that because I think we're all vaccinated and boosted.
And I do think, just to add, you can get, I know we just talked earlier that in the community, some people are having challenges finding the booster appointment, but you can clearly get one from the Campus Health Center for free, just like the testing. And I know that we're going to put the link that you can see on the screenshot or on the screen, but you can get the booster at the Campus Health Center. There's a link there. You can sign up for an appointment, or you can call the vaccine hotline, which is 577-5105, and get an appointment. We're also going to be offering 3 special booster clinics on December 15th through the 17th, so that people can get their booster in time for the holidays. So we're just really trying to make it clear to our whole campus population that if you've been vaccinated, a booster is a really good idea. I'm getting mine on Monday at the Campus Health Center.
And getting your booster is a good time to get your flu shot too. And we talked about that last time, that it's safe and effective to get both of them together. Let's see. This is a campus procedure question. Will fall semester finals be held in person or online? And our direction to you is, if you're a student, consult with your faculty member. Some faculty members have elected to move some of their final exams from what was planned as on campus to an online option, and they'll be the best source of information. So I would say, for every class you're taking, consult with your faculty member individually to make certain that you know the modality for final exams. And a related question is about winter semester. So are we anticipating that campus is going to have normal operations in January for the winter semester? And the answer is yes. The expectation is that winter semester will proceed in the way that the academic schedule was posted. So if you are posted to have an in-person class, it's expected that it will be an in-person class. And as we have done since the pandemic began, we will continue to monitor data on campus in the city. And if anything changes, you will hear large broadcast messages. But we've reason to be optimistic. So there is an expectation that whatever modality you signed up for January is the modality that you'll have. Anything to add to that, either Ramona or Tina? Will the mask mandate likely be extended into January to start the winter semester? It's probably pretty likely. And we're going to continue to watch the data about transmission. And as we've said, the Campus Health Committee's recommendation to the university administration is that as long as we remain where the CDC is recommending masks in public spaces, and now we know that about 3 weeks ago, the state of Michigan has issued a mask advisory for public spaces, encouraging folks to wear masks when in public settings, indoors. We will continue to monitor the data. When transmission drops below substantial in our region, we'll make a recommendation that we drop the mask mandate too, but we're not there yet. We will get there, and spring is a very hopeful time. Someone asked about what are the tipping point metrics that the Campus Health Committee focuses on. And those metrics are public, and they're publicly available. They're posted on wayne.edu/coronavirus, and you can look at the metrics. They indicate what we do at each level of tipping point metric. They are largely about the numbers of cases in the city, on campus, positivity rates in the city, on campus, compliance with mitigation measures like the mask mandate, and bed capacity, availability of beds, hospital beds, should people need them. And the Campus Health Committee looks at the weekly metrics every Monday. We do follow metrics on a daily basis, but we look and publish metrics as of Saturday at midnight, and we publish them Monday morning on the Campus Health Center website so that you can see them there. I'm gonna ask all of us to take a crack at this last question, because I think this one reflects the way a lot of people have been thinking, and so I want to give us all a chance to talk about our perspectives on this one. Someone submitted a question that said, "I'm feeling a bit defeated. What optimism do you have for those of us who followed the rules during this pandemic? We got vaccinated, we've practiced social distancing, we're still wearing masks. When are things going to get better?" I think that's a really good and honest question, and I'm really glad that someone asked it. I'm going to take a crack at what gives me optimism, and then I'm going to ask my colleagues who are smarter than me what gives them optimism. But for me, I think there are a couple of things. The first is that boosters are available, and that we're seeing that people have significant immune response to a booster vaccine. The second is the wide availability now of vaccines for children who were previously ineligible. And so at this year's holiday tables, there are going to be a lot more vaccinated kids than there would have been at summer events even. And I think that's a reason for optimism. And a third for me, I think, is that we're seeing the development of what are very promising therapeutics that will help us move COVID from pandemic to endemic stage. And both Merck and Pfizer have requested emergency use authorization, and the FDA has granted EUA for Merck first. And these, home available pills to take at home, which have substantial impact on, again, reducing hospitalization and mortality in people with COVID, remind me a little bit of, and it's not a perfect analogy, but influenza and Tamiflu. That as we learn to manage with home therapeutics, there's reason to believe that over time, COVID's going to become a less threatening illness in every instance. There will still be people who have severe negative effects from COVID, the same way people have severe negative effects from influenza. But I think there are many sort of converging developments that give us real optimism about what the future looks like. So I'll ask my colleagues. Tina, what
Yeah, I totally agree with you, Laurie, and I should answer this question philosophical and scientifically. So philosophically, I would say that what gives me optimism is the fact that all of you are masking, and all of you are vaccinating, and all of you are getting your boosters and talking about it. And being so mindful and aware of the campus guidelines, as well as the campus, the faith that you have put in the public health committee is also extremely a thing that gives me optimism. Secondly, the scientifically speaking, what Dean Clabo mentioned, I think this is not March 2020. This is not the same situation we were before. And if you look back, we are compared to last year March, we are in a much better position as far as our population overall more population is vaccinated. A lot of us have traveled already and been safe. In addition to that, we have better therapeutics, like Dean Clabo mentioned. We have a lot of tools in our toolbox to fight this virus, and a lot of tools to prevent the virus. And on top of that, a lot of funding to do more research and surveillance on various variants. And that's why we have known about the variant before it has come to our country. And all of these things, I think, are giving us a lot of hope and optimism for the future.
Thanks, Tina. Ramona, you feeling defeated?
I think that I'm feeling a lot more optimistic this holiday season than I did last season. I mean, I guess more of a personal example. Last year at Thanksgiving and at the holiday time, my family canceled everything. We sort of saw each other on Facebook on Zoom and did Zoom. But this year at Thanksgiving, we talked with each other about, okay, who's boosted, who's not, who's getting testing, who's not. And we all were able to get together at Thanksgiving safely. No one's gotten ill. We all got, had our doses, and even small children were there who were pre-tested and are getting their vaccine soon. So I'm hoping, this holiday in December, I'll be able to see them all again. And so it's more of a personal example. I just feel so much better being close to them and having that opportunity.
So at least from the three of us, reason to be optimistic. This has been a longer slog than I think all of us anticipated in March. But we've also, it's astounding when we think about the scientific developments that have occurred, as Tina said, in an incredibly short time, that both effective vaccines were developed, rolled out, administered, and now effective therapeutics beginning to be made more widely available. It's longer than we thought, but the progress has been at a pretty steep curve, and there is much to be optimistic about. And I think, echoing a point Tina said, the safety of this campus has been as a result of everyone, faculty, staff, students, doing the right thing, following mitigation efforts, wearing your masks, being careful, getting tested before and after travel, before gatherings, avoiding some of those really jam-packed public events. And again, plans for commencement that are a little different than they were in the past, but will allow us to gather in person safely to celebrate our graduates' accomplishments. There's lots to be hopeful about.
Can I just add, I know
Sure.
that we really, really want people to get vaccinated, but I will say, since I help with the Campus Daily Screener just about every day periodically, I really feel positive about all those who've made, for whatever reason, a decision not to get vaccinated. They are being careful. People are wearing masks. They're protecting themselves with their families. So I think, everyone's trying to do the best they can do in this unfortunate situation we're all in.
I think that's a really good point. Thank you. Thank you. I note that we're out of time, so I would thank Dr. Chopra, Dr. Bankert, thank all of you for joining us today. Encourage you to continue to submit questions to healthcommittee@wayne.edu. Keep your eyes on the coronavirus page on the university website, where we list daily conditions and daily strategies required on campus. We're all in a much better place than we were this time last year, and we hope that you and your families have a safe and wonderful holiday season. Good luck at the end of the semester to our students, faculty, staff. Happy holidays from all of us.